Okay, we are live.
Thanks, Shannon. Thank you, everybody, for showing up to the Zoom call to talk about COVID-19 in the community. Really wanted to thank you again for getting the message out over these last couple of months, and it's going to be even more important now to get the message out and make sure that it's clear and it's effective. Last weekend, we had about 13 positive cases that we had over the couple of days. This weekend, we had a significant jump. Actually, probably around 33 plus at this point in time. Again, numbers are still coming in. So that is definitely a significant jump, and it is a concern of ours. The issue really comes to that, we're seeing it in the rest of Ohio. We've experienced it over the last week or so there, but we're also seeing it through the rest of the country. But more significantly, it's a holiday weekend. And we really want to make sure that we're getting the message out about keeping ourselves healthy, about keeping those around us healthy as well too. We talked about social distancing, hand washing. I think maybe let's talk a little bit differently about what we need to do. Time, distance, and shielding. It's one of those things we've talked about before with some other diseases, but the amount of time that you spend with somebody, the distance that you're actually away from somebody with the disease, and then the shielding, which is the mask or a barrier between you and another person. So time, distance, shielding is really important. The idea here is to, again, make sure we understand that we are still in the midst of this disease. It's actually, we see that it's increasing, and that we need to take precautions really right now before it spirals too much out of control. Shannon, do you have the graph we'd like to show today? There's a graphic that I'd like to show, and we'll try to get it up here. So we've created this graph for everybody to kind of take a look at. If you look at the graph, you see the purple is April, the blue is May, and then you have the green in June. So if we look at the 55 to 65-year-olds back in April and May, you see a significant amount of disease in those age groups, but it actually does tail off come June. Kind of makes sense. We've talked a lot about this age group. I think they've taken some great precautions, and that, again, they know that they're in that high risk group. But let's take a look at the 18 to 40-year-olds right now. You saw that, in April, we didn't have very many cases. May, it kind of creeped up on us. Now look at June. All three of those age groups, you're seeing an increase in the cases overall. So again, what we're experiencing throughout the state as well as throughout the country, that these age groups are the ones that are seeing the most significant increase in cases. Why is that? I think we talked a little bit about this last week. Again, going back to work, but also then too, I think these age groups too, they're trying to get out and go back to a normal life. So again, they're experiencing the restaurant and bar scene. They're getting together more often. So I think we're seeing a little bit of that. We are looking at the issue of the bars and restaurants of actually seeing numbers come out of those bars and restaurants. So we have some commonalities of going out and participating in those activities. Again, I think if we're doing them appropriately, we're talking about, social distancing, wearing a face covering, and again, making sure that we're keeping ourselves safe. We could probably go out and do some of those things, but again, we're not probably seeing as much of that as we could. Shannon, you want to take off the chart now? Thanks, Shannon. So the issue that we have right now is the coming weekend, and just want to make sure that we're getting enough of the message out to the community of, again, making sure that you're keeping your hands washed, that you're wearing a face covering, and that you're social distancing. So time, distance, shielding, again, it's extremely important. So with that said, Shannon, I don't know, did you want to cover anything else right now, or do we want to open up for questions?
Thanks, Eric. I think we can open up for questions.
Hi, Shannon. It's Melissa Bates from 13 ABC.
And Melissa.
Hi. Eric, if you did it sounded to me like you have had, through contact tracing, traced some of these, the increase in these younger cases to actual bar locations. Am I correct in saying that?
I think there's commonalities across the board of, there's some workplaces, there are some restaurants and bars, there's travel out of the county to other counties. So it is a mixture, Melissa.
Okay. Tell me how important contact tracing is and how are we doing? I know we had an effort with UT to increase our number of contact tracers. How is Lucas County doing with that?
Again, UT is doing a phenomenal job with the contact tracing. We over the last couple of weeks have several hundred, if you would, several hundred names that went to UT to follow up. And again, the support that they're giving us is phenomenal, to the point that actually other counties are calling me to find out how to actually make that work with their universities. So again, we go through this process. We're always trying to fine tune it. Matter of fact, we just had a meeting this morning to look at the process and procedure, see how we're doing, to see if we needed to actually change up anything. So again, it's always a work in progress to make it better.
How many contact tracers do we have right now and how many will we have?
Sure, again, it does vary, but again, we have about 100 to 150 contact tracers that we can actually utilize. Then we have the backups, of course, of probably about 25 to 30 individuals that we would use if we needed.
Okay. There are pictures of large gatherings. Puddin Bay is one of them that has come through to a lot of the newsrooms. I mean, and it's shoulder to shoulder, people without masks. I mean, how detrimental is that to our efforts to control this virus?
Well, Melissa, you can just imagine that, again, we talked about time distance shielding, getting away from each other as much as you possibly can, wearing a face covering, keeping, again, healthy and get the hands washed. So you can just imagine being in that close quarters and then having this disease be able to spread from person to person. Now, again, we got to realize that we're not seeing a lot of the detrimental type of symptoms and then hospitalizations with these lower age groups. But unfortunately, we've actually had to contact family members of those individuals who are positive, who now are also positive family members who are older. So again, it's a domino effect where we have we have a younger population that goes home, maybe visits mom and dad, grandma, grandpa, and then we have some real concerns. So we've always talked about this, that younger age group we are concerned with, but we're also understanding that younger age group has more detriment of spreading it to somebody who is immunocompromised or elderly than just themselves. And that's not saying that those younger populations are not going to have severe complications, but again, we're not seeing that as much as we do in the elderly.
Can you go down, explain a little bit to our viewers a little bit more how important, like you had mentioned a week or two ago about how contact tracing, during the quarantine was so much easier. Now it's how many people deep and how much more work do you have to do to contact trace?
Well, think of those pictures that you just talked about at Puddin Bay. Those individuals, again, one individual is in contact with maybe 20 individuals standing in line or in an area for an extended amount of time. It's unlike when we had the quarantine, if you would, where kind of everybody was at home. Maybe they went out to the grocery store. So you're not going to have as many, contacts of that individual to follow up on. So that's the main concern here, that again, that individual could have multiple contacts now where possibly they only had a few.
All right. I mean, can you go down explain to us? I mean, you have to go how many people deep to contact trace how many?
Again, it all depends. If I'm standing in line for 20 minutes, or I'm at a bar and I'm infectious, again, it could be a number of individuals I came in contact with, and some of those people I may or may not even know. It's a little bit easier inside of a business where you can go ahead and say, I was next to Jimmy and Joan and Joanne for an extended amount of time, so you can get a better list. But again, it's all scenario driven in the sense of where you're at when you actually are infectious and who you've come in contact with.
Okay, thank you.
Sure.
Hi, Eric. I'm wondering if you can talk a little bit about, we've seen states in the South have to close things again because of the spike in numbers. Obviously, we're not at that severe point at this point, but is that a possibility? Could that happen if we don't get things under control here?
I do believe that you might have seen a story last week over the weekend. The governor is looking at county by county data and looking at a process to maybe implement some of those, we'll call them precision closures or precision remedies to the issue that's at hand at that point in time. So that is a distinct possibility. That's why it's really important for us, all of us, to take this seriously and try to protect not only ourselves, but each other, because we don't want to get into a position where we have to start rolling back things, maybe closing bars or restaurants or curtailing things that we'd like to be able to do. We just have to make sure that we're doing the right thing, and that is wearing a face covering, keeping as much distance as you possibly can, but still experiencing things we need to do in life.
On the topic of face coverings, we've seen some communities, mandate them when you're going out in public. Is that a possibility here if, things don't get under control?
Again, that's something that I think all of us who are in public health are exploring. I know that some of my fellow health commissioners have already been in conversation about that. I've been involved in that conversation. So again, we're looking at this stepwise process. We're looking at what the governor is going to do and the plan that he has, and we'll go ahead and make sure that we follow the best public health we can.
Now, at this point, we've been right when the restaurants, the bars opened back up. From what I understood, the governor was mandating that employees wear face coverings, but we've been getting a lot of calls and complaints, as I'm sure you guys have, that not all employees at this point are still doing that. Is that still required at restaurants and bars in Ohio?
That is required, but as you know, there's exemptions to that rule depending on the individual's condition and what they're doing at that point in time. So again, some of those individuals that aren't wearing masks probably have a legitimate exemption, while others may be stretching it a little bit. I urge everybody who should be wearing a face mask or who can be wearing a face mask to actually do that, because it will help us, again, not having to look at maybe rolling back things that are already open.
Are you guys following up with any restaurants or bars who aren't having their employees wear masks? Is that something you've been seeing more so?
Actually, we do. We do follow up with those bars and restaurants and actually businesses, and we talk to them about that. And we try to really convince them that it is the best thing for their employees, but also then their customers.
Eric, we have a question from Facebook. Can we track a spike back to Memorial Day weekend?
As we're looking at doing the contact tracing, we do try to pinpoint, again, dates and things of that nature. But again, that's kind of difficult at this point in time to actually hone in on Memorial Day weekend. I do believe that some of these cases do come from Memorial Day weekend, but we got to remember too, the concern we have here is pre-symptomatic or asymptomatic individuals, could have been, again, attending parties or things of that nature Memorial Day weekend. And again, we'll never know about that. The thing that we do like to do is get as much information as possible. And sometimes too, people really don't remember maybe what they were doing in a specific day or a specific time or who they were with. So that's always the trouble with trying to do some of this contact tracing. We've done this for years with other diseases. So there, again, it's not a perfect system, but I think again, we have the ability to contact trace pretty well. And as long as we're following our procedures and our process and asking those questions, we can get to the point where we do protect the community.
There's another question from Facebook. Is wearing a mask required at businesses?
Again, the businesses, there's those guidance documents. So like at a bar or restaurant, those employees should be wearing face coverings. You walk into, I went into Lowe's over the weekend, and those employees were wearing face coverings as well as behind plastic shields. Again, that shielding type of idea. But it does go back to, there are individuals who, for whatever reason, just cannot wear a face covering. And again, I think that's why the governor and the ODH put those exemptions in there.
Eric, it's Melissa Vage from 13 ABC again. Local health departments, do they have the jurisdiction to require, say, within Lucas County, people to wear face masks, or is that a state mandate from the governor? Does that have to be a state mandate?
Most good question. We're really looking towards the state to help us out on that. We do have some ability. It has to go through more of a rigid legal process to actually get there. Again, that's kind of what the health commissioners are discussing at this point in time to figure out exactly how do we make that happen if need be.
So it is possible for, say, Lucas County to mandate. That was an unclear answer. I'm sorry, and my dog was barking.
Again, it's not as easy as if the governor would mandate it, but we do have we do have a legal process that we have to follow to be able to do that. But again, I'd rather have my prosecutor respond to my question that I posed him earlier today. Anything else, ladies and gentlemen?
Eric, maybe a question in the chat.
Oh, yep, there you go. Do you see that?
Again, I'm not going to say that's 100% true about, do we feel that we're increasing in cases because Lucas County is becoming lax in what we're doing? I do believe that really the entire state has that issue. I am seeing some possibility of some of these infections coming from individuals who have traveled and they're coming back. So I would have to say that lax in the sense that we should be all wearing face coverings when we're out and about, and again, doing those things to keep ourselves safe and everybody else around us. But again, I think what we're seeing here over the last couple of weeks is just kind of this, well, it's not here. The disease, we're really not hearing about it. Well, unfortunately, we're going to start hearing about it now, especially in Lucas County, if we continue this trend of the disease state. So again, I think it wasn't at people's, the front of their minds to actually be doing some things because they're not hearing about it. But again, we're going to have to start really talking about this and figuring out what to do if we continue to see these cases increase.
Eric, there's a question from the Blade about people seeking testing.
Mm-hmm.
The last time that you had spoke with them, you had reported that there was a dip in testing. Is that still the case?
I just got word this morning that there was actually I think it was, forgive me, there was one of the big box testing facilities here in Lucas County that they actually have no more room for appointments. So again, I can't say for sure, but that was just some anecdotal information I got this morning. So I could check into that a little bit more. Again, I haven't heard completely about the other big box stores that are actually testing right now. So I could probably look into that and get back to you.
And testing is available for everyone in Lucas County, or do individuals have to be symptomatic to get a test?
Again, if you think you've been exposed, you can go ahead and actually go ahead and get the test. It's not like it was before where you had to be, symptomatic or a certain age. So again, all the priority areas have been opened up by the Ohio Department of Health. Yes, we really do need to stay vigilant. Again, in the chat box, we need to stay vigilant because again, we all have a responsibility to ourselves and our family, but also I do believe we have responsibility to everybody around us. And it's really important, again, to make sure that we're doing the things to keep ourselves and our family healthy, but those who are standing next to us in line or that we're speaking to because, again, we have to go to the store or we're out and about.
All right, I believe that is all the questions. If there are any others that need to come through, please go ahead and use the chat box.
Thank you, everybody. Please continue getting that message out, and it is really important right now so that, again, we don't have major issues in the coming weeks. So I appreciate everybody out there and what you do.